So now when you have a patient who suddenly drop a fork and sudden weakness, that's the main thing. Then we think of a couple of differentials. Could be seizure, could be hypoglycemia, could be electrolyte imbalance, could be brain tumor, could be labyrinthitis or labyrinthine disease. So for hypoglycemia we check glucose, obviously caticoline, that's if we get lost we always do that. Seizure, maybe we can do head CT EEG if it's high on differentials. Brain tumor, that's an important one, so that's why we had to do head CT. We do carotid Doppler, that's an important one. And echo, EKG, those are important ones because we gotta find the source of emboli. What caused that weakness? Okay, so we have three things, okay? So if we found, this is number one, very important. We do CT and then aspirin after that. And then depend on the results that will control the management. So if we find atrial fibrillation, we treat it accordingly. If we find carotid stenosis, we treat it accordingly. And there's general management. So let's go to the general one. The general management, we give aspirin plus dipyridamole, or you can give clopidogrel. Okay. If it's non-cardioembolic. Okay. Or not atheroembolic. Or we can give aspirin plus clopidogrel or dipyridamole if atheroembolic, or Lacunar stroke, or cryptogenic. Okay. Now this is the general management. Now if we found on carotid Doppler there's carotid stenosis, how do we manage that? We do pre-op PT, INR, cefazolin, plus we give carotid endarterectomy, and then we counsel about hypertension, diabetes, smoking, hyperlipidemia. If there is cardioembolic atrial fibrillation, then that's the management. What we're gonna do, we're gonna do low molecular weight heparin. This is controversial, some recommended, some not. And we can give oral anticoagulant, for example warfarin, dabigatran, apixaban, it's an important one. Or we can do thrombin inhibitor plus factor 10 inhibitor, also we can give them. Okay, and then what do you want to counsel about?
Right? For these people.
Yeah, you counsel about medication compliance, this is very
Right.
important. And then you do INR every day, that's an important, anyone who's in warfarin every day. And you do platelet count on day 3 while on heparin. The way I recommend it, I just order CBC Q
Hmm.
day, and then I order INR Q day, so that
Only the INR only if they're on warfarin, right? Otherwise, we don't need to.
yeah, exactly. Only if you started warfarin. Yeah. Now
What the
the more
factor inhibitors are which ones? Is that rivaroxaban, apixaban?
yeah,
That's factor.
yeah, yeah. So that's the thing. Now for you counsel about no smoking, no alcohol, no regular exercise, diabetic, all of these good stuff, and then you want to do cardiac monitor. That's the one that you really want to do monitor. Okay. and then you just do ER and inpatient management. That's the case. Okay, and that's a summary for this case.